none of you need bypass surgery. To prove that, they did laser bypass surgery and told them all of you will do bypass surgery. But they divided them into two groups at random. One went to A, another went to B. The A protocol was operate, anesthetize, operate, send. B was anesthetize, keep him there for 2 hours, wake him up and send. While sending, still you had a wonderful operation. Very successful. And would you believe after 5 years, the B theatre fellows are all absolutely healthy. Thallium scans showed blood flow back again to their vessels. Can you believe that? In the A theatre fellows had 2-3 operations and then lot of problems. 10% of them are with their maker in heaven. Intervention. Now that is not what we have to buy for India. Now Modi goes there and then the WTO and fellows will brainwash him and all his old training will probably, I hope, won't vanish. I'm hoping and praying that he will still have his feet on his ground, head in the 9th cloud, doesn't matter. But he'll come back and say, okay, we will want still water, toilet and swachhata and things like that. All of us must support him. Then, for treatment, diseases are accidents. Even if you are a saint, even if you follow all that Ramesh said, you still can get a disease. Because diseases will come in a closed system without anybody knowing it. When you get it, what to do is the next question. And for that, the Ayurvedic system, the Siddha system has wonderful things. Even homeopathy has been scientifically proven methods. And various things that we are trying in the TAG center also will help patients and reduce the burden of the healthcare delivery in the country, which is already reeling under poverty. And we have to now, our preference is not to get more hospitals for transplant surgery. We have to look after those poor fellows who don't have 3 square meals. 47 million children have NIDS. Sub-Saharan Africa together is 42 million, which means just 1 meal a day for the child will save its life. And then if you have these village women looked after with a simple dye system, I have devised and I have sent to the Prime Minister also, you can make every village school a health center. All that is required is every teacher is given a training for about 3 months to recognize serious illnesses. His or her job is to go to about 10 houses in the village every morning before coming to the school, finding out everything. Now supposing a child has fever, and child has a simple fever, nothing to worry. The household remedy is okay. But the child has fever and it can't see light, then immediately phone the Taluka hospital saying that this is probably meningitis. If a child has fever, it breathes faster, child probably has pneumonia. And so when child has diarrhea, you teach the woman how to give some salt and water and sugar. But if the child is not passing urine, you will inform. So this will cut the 2 to 3 crore budget of the primary health center, where the doctor neither works nor the doctor doesn't know how to work because he is not trained for that. Today's MBBS trains a doctor with all the gadgets to be a very good assistant or to be a MD student or an MS student in the Western hospitals or go and help the Western hospitals as a junior doctor. You put him in the village, even if he's a very good doctor, if he's a conscientious doctor, he'll run away from that because he is taught in that school. Krishnamurti Srinu was telling them that 1% of a headache can be the beginning of a cancer in the brain. You must have an MRI for every headache. That fellow will say, this fellow says, Talavali sir, Talavaliya, am I missing this 1% cancer? Coach, we have not taught them clinical medicine at all. If you teach them clinical medicine, there is a study which is published in the British Journal which says 80% of the final diagnosis, mind you, 80% of the accurate final diagnosis and 100% of what to do with this patient can be arrived at listening to the patient and examining. Can you believe that? I can tell you what you need after listening to you and touching you, examining you. People don't touch patients these days. Yesterday here only I saw a patient, a doctor's husband, who was being treated for coronary arteries and heart failure, and what he had was cirrhosis liver. He's a big drunkard. And he has a liver which is so big, and the spleen is coming to you and telling, I am here, man. I am here. And he has got ascites and edema, but the edema was thought to be due to congestive failure and treated extensively for coronary artery disease because he had unfortunately a lesion in the coronary artery. Fortunately, that's why he is alive. If he didn't have it, he would have died. This is our fate. So the future policy for India would be to use all our medical resources, look after the health of our people, populace in general, especially the poor people, and then the remaining few persons who can afford, they can of course go to the 5-star hospital for even the cold. They can get the best 5-star treatment for common cold in a 5-star hospital and pay about a couple of lakhs of bill. But what about the poor man? poor man must also get the quality, scientifically proven treatment, which can be done by training our doctors of the future. I have given an idea to the Prime Minister that village doctors have a different kind of MBBS, where they only treat how to treat villages, patients on the clinical bedside. And they are forced to go to the village for 5 years because their internship is in the village for 5 years. After that, they get 1 year course, condensed course for the regular MBBS, where they are taught all these gadgets, and then they can go for MD or MS or whatever. These 5 years they spend in the village, they have a wonderful doctor who is not only studying, who is compassionate to look after the doctors. So if all is, you will be surprised, the French government, without money for their NHS, started a Chinese medical hospital in Paris, 100-bedded hospital. Would you believe in the next year, their budget on the NHS came down by about 75%. Because most people with minor illness syndromes went there. Today, even a minor illness syndrome goes to the hospital, taxing the budget and then bringing down the cost and making the hospital inefficient. All that can be avoided. Only those people, 1% of the population requires all these gadgets, 1% of the sick population. And that can be treated in 5-star hospitals. Rest of them can be treated in a... If we ape the West and go like that, because today the ministers are saying we want one AIMS in every capital of this. One AIMS itself should be closed if you ask me. Because if you audit, now let us say today is Diabetes Day, you go and audit the diabetic coma treatment outcomes in Safdarjung Hospital vis-a-vis AIMS. AIMS has about 4 to 5 patients in a week of diabetic coma. Safdarjung will have 50 to 100. And AIMS has 20 diabetologists and endocrinologists to look after those 4 patients. There's 2 doctors to look after the 100 patients. But the outcome is better in Safdarjung than in AIMS. Because you do so many tests and so many interventions unnecessarily. And if you do too many tests and too many interventions, patients suffer. Today, America has realized. Mary Tinetti, who is professor in Yale, says, our conventional treatment of diagnosis and treatment has become outdated now. We have to think of a new thing. So diagnosis is not the new disease which is bugging you, but what is bugging the patient is more important. Try to understand the patient. And trying to understand the patient is just listening to the patient, not testing anything else. And this should be the aim for the future. And let this come from the VHS hospital source and go to the highest authorities and say that we can prove, we have got data to prove that. And then if they are convinced, because today we have a health minister who is from AIMS, so nothing will probably go into his head. But we have others there who will probably do something about it. And we should now push this agenda, lest this country also go down the drain like the West and then waste your money for unnecessary things. Our budget is so small for health, you will be surprised. The American budget is so high in spite of that. Now there is a beautiful study of 14 industrialized countries which is published, which showed that America, with the costliest medical care and the largest number of per capita doctors, is the worst among the 14 industrialized countries. Japan, with the lowest budget and the lowest number of specialists, 1% of Japanese doctors are specialists, 99% are generalists. America, 99.9% are specialists and 1.1% are generalists. And America is the worst, Japan is the best. And Japan has only 100 doctors per 1 lakh population. America is 493. Even then, because the specialists overdiagnose, overtreat, and end up in death. If you want to know exactly how much it is, they did a study between Ontario and Philadelphia. Ontario is NHS, where the doctor doesn't get money. Philadelphia, fee for service. When one bypass surgery was done on the population, it's identical population. They came from the same place in Europe in the olden days when they migrated to the West. And then 10 operations were done in Philadelphia. So the Americans said, the editorial said, we in America are more advanced than these Canadians. They don't know. That's why we do more. After 10 years they audited and they found more people alive in Ontario in that group than in Philadelphia. Then the editorial came, and this was written by Harlan Krumholtz, who is the chief of cardiology and this is a telling sentence. I'll end my speech with that. He said, bypass surgery and angioplasty brings in billions of dollars in cash for the hospital till for the doctors who are doing the work and for the instrument manufacturers. And this is why, and they get television interviews and paper illustrations. And that is why we do that and not to help patients. Can you get that? And this is the truth and the real truth. The hard truth, harsh truth is not wanted. I know so many in the audience now will say, what this rascal is talking about? Nonsense. No, nonsense he's talking. I know. I would like you to believe like that. But I would pray that you also think about it. Think. Go home and think. You think BM Hegde is a rascal, doesn't matter. It doesn't matter at all. Because since you know what you are, you don't have to worry about what others think. I always tell them, if I'm an ass and I think I'm a tiger and I want to project to the world I'm a tiger, then if you say hey, you're an ass, you get terribly angry. I'm always stressed because I want to be a tiger out. But if I know I'm an ass and I accept I'm an ass, what is there? One person wrote a very damaging letter to me after my last edit in the Hindu. Then I said, yes, vanga. We are getting DR Karthikeyan Saab. He has flown from so many places just to be with us. He is such a nice man, so he wanted himself to be associated with this function, and he had to be in Bangalore for a board meeting, he had to be in Delhi something. In between, he is sandwiched Chennai for 1 hour. He is coming from the airport and has to go back to the airport. Last sentence. So, please friends, try to understand. The open system means intervention at every level, which is detrimental to the human body. So we don't want the pseudo-science of the West. We want the true science of medicine, of the closed systems biology, which emanated originally from India, and it's now going to the West from India. And the West is accepting it. You will be surprised now. Yoga has become an authentic therapy. I have a friend of mine who was a professor of cardiovascular surgery doing bypass surgeries for others, and he had little chest pain, and somebody gave him a morphia injection. He became unconscious. By the time he got up, he had a bypass surgery already. Dilip Sarkar is his name. He is a Bengali. He was a professor of cardiovascular surgery in Virginia. Now he has resigned from his job. Even after bypass surgery, he doesn't touch a Western medicine. I told him, you had a bypass surgery and you had an angioplasty. Now don't you at least take some aspirin? He says, sir, I know how to keep my blood thin. He is now the teacher of yoga, going around America and the world teaching yoga. And he is a part of a university in America called the Taksha University, which is started by a NASA scientist who is an Indian to teach Indian wisdom in America. They give diplomas, degrees, PhD, everything. And this is basically situated in Virginia and California and New York. They have got 3 campuses and is doing very well. And this is the kind of thing that we must spread in the West. And being spread in the West, we in India still aim what the West says. You know, when it comes from the West, it's good. See, for example, I was telling, blood pressure lowering drugs are very dangerous, so take it very cautiously. Now, I was saying calcium channel blockers, lot to do. See, any blocking the system, nature, don't go against nature. Yesterday, America admits now, calcium channel blockers can produce breast cancer, and one of the very important causes of breast cancer. Beta blockers are one of the important causes of strokes. Now, if you know this, and we know it from but they don't want it. But when it comes from America, yes. In India from 17th century, when a cow gets a severe infection, another cow's cow dung was given to that cow. Copying that, an American professor in Johns Hopkins Medical College, Dr. Chan, she had children dying of silly infections with Clostridium difficile. She gave the shit of the mother to the child, and the child recovered. Now it's a recognized treatment in the West called fecal transplant. And America says fecal transplant, yes, fecal transplant. Now you'll be surprised, poop capsules are available. I'm not joking. Poop capsules are available in America. So if you have any sort of immune deficiency or anything, buy a few poop capsules and so on. On the level, when Murarji Desai was saying the best immune booster is your own urine, drink it. If you don't have any disease and if you're not a non-vegetarian, drink your urine. It's an immune booster. Now it's proved in the West. And Swayambhu is a big part of Ayurveda. Russia, there are thousands of books on the auto-urine therapy. And I have been able to have a large number of patients, autoimmune diseases with no treatment. You will be surprised. Ulcerative colitis in 1 week get controlled with your own urine, provided you are not having any disease. But இதெல்லாம் நான் சொன்னேன் என்ன சொன்னாங்க தெரியுமா திருட்டு அவனுக்கு என்னமோ பையன் என்னமோ சொல்லிட்டு இருக்கான் அப்படிமா பேப்பரும் எழுத மாட்டான். See, I used to have a column in the Hindu when Ravi was the original editor. Then suddenly it stopped. Then occasionally they'll pick up one and put it there. And if somebody decries that, they'll come as a letter to the editor. Thousands of people will say it's very good, they won't put it. Kadasile ennachi, one American wrote against a letter that came in the Hindu, one Tin Heinemann or someone. So I thought they will not send it. So he said, Hindu may not publish it, but I am sending it to you. So I kept quiet. But the next day Hindu published. CVK says Hindu has published. Thank you very much. And may this country live forever. And may we regain our glory with our own, standing on our own feet. And Rabindranath Tagore said, let us have the foundation for medicine which is Indian. Let us have the roof for medicine which is Indian. But let's have the windows and the doors open for wisdom to come from all sides, including the West. Thank you. Because emergency quick fix comes from the Western medicine. Supposing I fall under the car now when I am going to the hotel, I can't say I'll do yoga and no. I'll have to be in the hospital. So that is only 1% of the population. So we require 1% of the hospitals having these facilities. The rest of them must be for common good. Thank you very much.
Thank you, Professor Hegde. We are all eagerly awaiting the historic announcement. I call upon Dr. C.V. Krishnaswamy to make the historic announcement, an outline of preliminary success in our efforts to find a cure or remission in the field of JIDDM. Over to Dr. C.V. Krishnaswamy.
Welcome, Karthikeyan sir. He is really a very, very close friend of our center, of all of us, and one of the, according to me, one of the best human beings in the country. Our well-wisher to the extent of a fault. He has taken so much trouble to come. Initially, when I said 14th, he said, I cannot make it on the 14th, I am already accepted. I said, I understand, sir. Then he said, when you call, I cannot, I will change the date for going somewhere else and change the date from 15 to 14. Then it so happened I didn't get the hall on the 14th and it came on the 15th. So I said, sir, you please accept that other one and come on the 15th. He said, no, I have cancelled that and I am now free, I will come on the 15th. So everything went well till yesterday, when suddenly some very, very important and urgent, I am sure, in his profession, important and urgent thing I have to excuse because there is somebody whose need is more than ours. They wanted him to come to Bangalore and attend a meeting. So he called them to the airport, came to Bangalore this morning, called them to the airport, had the meeting and then came by 12 o'clock and is here on time. I really appreciate, sir, the extent to which you can accommodate us is amazing, and I thank you for all this. Any angle you may name, we couldn't find the cause for the juvenile insulin dependence. A child of 2 comes to us. You diagnose juvenile diabetes. How do you diagnose?